Welcome to Sister Sharpens Sister on this Memorial Day. We hope that you are celebrating safely and enjoying yourself. We are actually going to grill some hamburgers later, so provided it doesn't rain. We've had some pretty bad weather. Today we are talking about procedural anxiety, which is something that a lot of people have issues with. And having been a nurse, I have just a teeny little bit of experience helping people with that. But unfortunately, because of events of this past week, I did not do a whole lot of research. So Delana is going to take the lead on this one.
Okay. We'll see how it goes. um, well, what I did was when we decided to do this, and I set up, some questions, and I basically went through and answered those questions. What I asked to begin with was, what is it? What is procedural anxiety? And according to what I found like a few different websites to get information from. Karen, and I'll put these websites for you to share.
Yep.
Acute procedural anxiety is an excessive fear of medical procedures resulting in acute distress and often interferes with completion of needed medical care. Patients may experience anxiety in anticipation of or during procedures used for screening, like for mammogram, diagnosis like an amniocentesis or something like that, or treatment like some type of major surgery. So now, acute procedural anxiety is not a diagnosed disorder in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DCM-5. It's not. However, specific phobia of clinical procedures is diagnosed when the patient's anxiety and fear are specific to the procedure and its immediate effects, and this fear causes significant distress or impairment. The most common specific phobias of clinical procedures are dental phobia, blood-injection-injury phobia, and the magnetic resonance imaging MRI claustrophobia. So specific phobias of clinical procedures are diagnosed as a specific phobia in the DSM-5, with a specifier indicating the type of phobic stimulus. So
I had a little bit of issue with the dentist for a long time, because when I was 6, and I don't know if Dee Dee remembers this or not, my baby teeth got abscessed.
Okay,
and I went to a dentist in Mullins, and he numbed me up. But when he went to pull it, it was not numb. It was not numb. I felt everything.
Mm-hmm.
Everything. Fast forward about 40 plus years, and other than cleanings and standard fillings, I had to have root canal done.
Mm-hmm.
And I was bouncing off the walls.
Yeah.
So they gave me sublingual Ativan.
Mm-hmm.
I was loopy.
Calmed you down though, didn't it?
I was knocked out. I guess I was calm.
Yeah. Yeah.
But I decided I wasn't going to do that again. So anytime I have to go to the dentist now,
Mm-hmm.
I do some specific things. I think about the procedure in my head. I get to know who the dentist is so that I know that I can trust them. And I do breathing exercises.
Mm-hmm.
So, but that's really the only procedural phobia that I've ever had. And I've had quite a few things done. C-sections and surgeries and surgeries and surgeries and nerve blocks. And,
yeah.
Yeah. Tattoos. Do tattoos count?
I don't think so. Even though it's should be set up in a sterile environment, I don't think it's considered a medical procedure.
That's true. It's not a medical procedure. But
so
there are
therefore
people who are afraid of needles who get tattoos.
Yes.
I have a son that's like that.
Yeah. Yeah. Well, you can be afraid of something, but being having a fear of something and having an anxiety of something are not the same thing.
That's true. That's
Okay,
true.
because for me, I don't have an anxiety of needles. I inject myself with needles every single day, being a type 1 diabetic. But when I go to have my blood drawn or to have a procedure done, watching them put that needle in me, cannot do it.
You have to
Can't
turn your
watch
head.
it. Yes. Once they get it in, I'm fine. I can watch them do whatever they want to do. But them actually putting that needle in, I cannot watch it.
I wanted to watch them do my carpal tunnel surgery, and the doctor was absolutely against it.
Yeah, not me. I don't want to see
He
it. I
said
don't want to.
if I knew you and knew you weren't going to freak out, then I might let you do it. But there's no way. I was like, okay,
Yeah,
that's
no.
understandable.
Yeah, I don't do that. Now, I think I do need to also mention that unlike general anxiety, which affects how you function in daily life, procedural anxiety is associated with medical procedures or hospital admissions. When anxiety builds to where it causes distress or interferes with a procedure, you may be experiencing an anxiety disorder and you should be treated for it.
Yeah.
So if it's preventing you from having a procedure done, or if you're having a lot of trouble after it's done, you should talk to somebody about it. We just need to put that out there, get help for it if that's what you've got.
Yeah.
Now, just a little bit of extra information is that a frequent symptom of blood injection injury phobia that distinguishes it from other specific phobia types is what is that word? Syncope. No, passing out. I never can remember how to pronounce it. Huh?
Syncope.
Syncope, that's it. I never can remember how to pronounce it. You pass out because of a fall in your blood pressure. I've never known anybody who's experienced it or even talked to anybody who said they have, but I've seen it on TV.
The syncope?
So, yeah.
My
passing out,
youngest daughter, you remember, you went with us when she got her ear pierced.
Yeah.
And we stood on either side of the chair, whatever it was she was in. And you remember, now, for anybody that doesn't know, I have two biracial children. Okay. She's dark complected. This girl turned white.
Yeah.
She did. She got so pale.
Yeah. Then the look on her face, I'll never forget that look on her face. It was like pure panic.
She was not there. She was not there.
So I don't know. I don't know what kind of phobia that would be called, since it's for piercings, and maybe it is. Maybe it is this needle phobia.
It may be.
Though it's not a medical procedure, it still may be classified under the same.
Well, it is a needle. You know what? It's a rather large needle too.
Yes. Oh yeah. Now, before I did the definition or anything, I came up with the questions of that I was going to answer, and one of them was, "Is it an actual phobia?" The answer is yes. It is an actual phobia. It's called tomophobia. I think I may not be saying that right, but hopefully I am. Tomophobia. And that comes from Greek. Tomos means cut and phobia means fear. So it's a phobic fear caused by an invasive medical procedure. So it is a phobia. And it's considered to be a specific phobia, which is a unique phobia related to a specific situation or thing. And in this case, it's a medical procedure. Now, here's the thing. While tomophobia isn't common, specific phobias in general are quite common. The National Institutes of Health reports that an estimated 12.5% of Americans will experience a specific phobia in their lifetimes. Now, to be considered a phobia, which is a type of anxiety disorder, the irrational fear must interfere with everyday life.
Well, let me ask a question. Did you see anywhere that this was a transitional phobia, or?
No. No, I didn't come across that. I mean, I did research and I did a bit of research, but I didn't see that. But I mean, there are ways to get over phobias, and some people say, meet your fear head on and you'll get over it. I don't know if that's how you do this or not.
Well, I mean, I'm afraid of bears, but I don't want to meet a bear head on to get over my.
I ain't gonna meet a bear head on either. No. And it's also important to note that tomophobia is similar to another phobia called trypanophobia, which is an extreme fear of needles or medical procedures involving injections or hypodermic needles. So maybe the trypanophobia is more toward piercings and tattoos.
It's hard to tell.
Yeah, so who knows? I don't know for sure. All I know is that it is a phobia. Who has it? Who has this type of phobia, this type of anxiety? The thing is that anybody can have it. Okay. Now, anxiety with procedures, and I got a lot of my information from a cystic fibrosis website, because when you have cystic fibrosis, there's a lot of medical procedures you may have to go through throughout your lifetime. And there are infants that are diagnosed with it and have to start when they're in infancy. And so there's apparently a lot of anxiety that can go along with that. So I pulled a lot of my information from a cystic fibrosis website, but I think it can also apply to other procedures.
Well, yeah, I think a lot of it's probably trauma induced.
Yeah, yeah. Now, another website that I use is medicalhomeportal.org. They say that anxiety with procedures is common among pediatric patients, and especially for children with special healthcare needs who have undergone special procedures. Procedural anxiety is usually due to fear of pain, perceived or actual, or recollection of similar negative experiences. So, now who's more likely to have it? Okay, children. Okay, we just discussed that. Now, and this came from the National Institutes of Health, National Library of Medicine. They say the highest prevalence of the blood injection injury phobia is found in women of reproductive age, but is only 3.3%. So it's low. Now, women who are over the age of 50, it's only 1.1%. So women who are outside of the age of reproduction, it's lower. In men,
I wonder if it's because they've had kids.
I don't know. I don't know. Now, in men of any age, it's between 0.7 to 0.8%. So the blood injection injury phobia is not a common phobia. Not a whole lot of people have it.
Yeah. Well, if you're a woman of reproductive age and you have a phobia of blood and injury, when you have kids and your kid wrecks a bike, you either get over it really fast or you find somebody else to take care of your kid.
Yeah. Yeah. Well, like we said, face it head on.
Yeah.
Help you get over it. So maybe that's what happens. I didn't look at the insides of why that is. That's just what the NIH says. So, now what triggers the anxiety? What triggers? So, procedural anxiety can be triggered by anticipation of pain or discomfort from needles, or placement of a vascular access device, such as a peripheral inserted central catheter, otherwise known as a PICC line or
yeah,
port.
One of those.
Someone who's had cancer treatment or anything like that, they know what these are. A sense of losing control, like not knowing what to expect in an unfamiliar setting, working with new healthcare providers, when the procedure is performed differently than what you're used to or than what you think is going to happen. Excuse me. So that sense of losing control can bring on the anxiety. Fear of something going wrong. That could be with anesthesia. That could be with, I don't know if you're having a hysterectomy. You may be afraid that the surgeon's going to hit your bowels or something, and that could cause a lot of trouble, or your kidneys, which could cause a lot of trouble. You can have these fears. Something that reminds you of a negative experience like sight, sound, or even smell. And we know that smell often brings back vivid memories. But it may not just be smell. It's like someone may smell rubbing alcohol and not get anything. But if you put them in a medical facility and pack that with the smell of rubbing alcohol, that could bring on the anxiety. So just worrying about the results of tests, like pulmonary function tests or any heart tests you might have, or if you have a lump in your breast and you won't go to the doctor because you're afraid it's cancer. This is another type. So it's like a performance type of anxiety. And something to note, for children is that parents can increase the anxiety in their children, especially young children, without intending to do so when they themselves appear highly nervous or try to minimize their children's fear.
Yep.
So don't look nervous. Don't be nervous. And if your child is nervous or scared, don't push it aside. Don't tell them they're wrong. Don't say, oh, there's nothing to be scared of. Don't tell them any of these things. Deal with it. Talk to them about it. And there's more stuff on down through my research that goes over how a parent can possibly deal with all of this with their children. Now, adults and children can experience procedural anxiety differently. Adolescents and adults may have developed the ability to use logic and can reassure themselves from positive past experiences to cope. For example, things like, oh, I've done this before, it went fine before, or, if you're going in to have carpal tunnel surgery done and you're nervous about it, you're like, well, you know what? These people do this every day. This is not a new procedure. It's nothing new to them. It's like driving a car or walking down the street. They know what they're doing.
Right.
So if you're a grown up, you can help yourself with it. A young child or a child cannot. So for younger children, talking about the procedure may bring more attention to their fears and it might make it worse. So you're going to need to rely on other ways to help your young children other than talking about things.
Well, one of the things that we used to recommend for kids coming in for procedures was to find somebody, a family member, or we would even reach out to, depending on the procedure, somebody that had had it done already so that they could talk to a child around their age.
And that, because anybody who's ever been around a child and the child's walking, they notice other children that fast. So they're going to relate better to those children than they will a grown up.
Yep.
So pay attention. Pay attention to what's going on when you start feeling the anxiety, or your child. Pay attention to your child and pay attention to what's going on when your child starts having this anxiety. Now, what are the symptoms? So, how do you know that you or your child are having this anxiety? How do you know? The symptoms of procedural anxiety can be the same as other types of anxieties. There can be sweating, feeling of breathlessness, irritability, shaking and trembling, heart palpitations, pounding heart or increased heart rate, loss of appetite, inability to speak or think clearly, a sensation of detachment from reality, fear of fainting, fear of losing control. Any of these things come along with, I think, any type of anxiety.
Yeah. So, and one of the things, too, to pay attention if you have kids or somebody that you're with, I mean, let's say I'm with my husband or my mother-in-law and they start complaining about dry mouth or their pupils get dilated or, those are physical things that you can pay attention to.
Mm-hmm. Yeah. So like we were saying before, pay attention to what's going on with them to realize that they are having issues, and you could pay attention to what's happening at that moment in time, because it may be a smell or a sound or like a nurse coming in or leaving. It could be anything like that could be causing the anxiety. Pay attention to it.
Let me interject here that there's something called white coat syndrome. Do you know what that is?
I've heard of it.
Okay, that's when somebody has like an increased heart rate and an increased blood pressure, but only when they're at the doctor's office.
Yep. Yeah.
Or only when they're in the emergency room. When they're at home, their blood pressure is fine, their heart rate's fine.
Mm-hmm.
That is white coat syndrome, and it's very real.
Yes.
People think that it's not. That's one of the reasons why they moved away from the typical white uniform for nursing staff that work pediatric wards.
Mm-hmm.
And they carry, like, I'm sure you've seen it on their stethoscope. There'll be like a little monkey, or the stethoscope has got a little sheath on it that's got, I don't know, the Avengers or Dora the Explorer wrapped around it.
It's a distraction.
Yeah, and it lessens the anxiety. It gives you something to talk about as well.
Mm-hmm. The dentist the girls go to, they just went in and had cleanings like a week and a half ago. The dentist was dressed as Mr. Incredible.
What is that?
It was superhero day, and everybody was in a superhero costume.
That is awesome.
That is awesome. That's
That
funny.
reminds me of Patch Adams,
Yeah.
right? The
Robin
guy that
Williams.
started
Yeah.
Red Nose Day. Robin Williams
Yeah.
played him in a movie. I forget the name of the
Yeah.
movie.
Patch Adams.
Patch Adams.
Was it Patch Adams?
Yeah.
I think so. Yeah.
That happened here in West Virginia. It was from a guy from West Virginia that started that.
Yeah.
Yeah.
Yeah. I know. Also, when the girls were little, the dentist here had like specific names for, here's Mr. Thirsty, which is the water, the thing that gives you the water. And then I forget all the names, but they had just cute little names for all the machinery that they're using to clean their teeth,
Mhm.
Yeah.
which helped relax them. Now, my oldest
Yeah.
still needed Valium a couple of times to go in there and get that done. But now she doesn't.
Yeah.
But it took some time.
Now, even
Yeah.
with older individuals, geriatric patients, you can use the same kind of techniques that you do with pediatric patients. You have angels on your lab coat, or you
Mhm.
have something around your
Apple
stethoscope.
pies. An apple pie on your stethoscope.
Well, yeah. Or, maybe you have a Charlie Brown on your uniform.
Mhm.
I worked with a lot of geriatric patients, and a lot of times that would be their memory not so good. They weren't like full-blown dementia. But if I was wearing something with Bugs Bunny or Tasmanian Devil or Betty Boop, I had a Betty Boop lab coat one time, and this one lady that I would go see, this was home health, she just loved Betty Boop, and she would pet my lab coat. She would talk about her, and it's
Yeah.
I don't know. Like Dee Dee said, it's a distraction
The
to
distraction.
get you away from what's happening.
Yeah. Yeah. Those are nice stories. Okay. The symptoms can be so overwhelming that it disrupts a person's ability to function before, during, or even after the medical procedure has ended. So that becomes a problem when the anxiety interferes with your ability to start or complete a procedure, if it leads you to avoid the procedure altogether, if it prevents you from coping effectively after the procedure is completed. So,
A lot of people that have had any kind of heart surgery done will have nightmares afterwards.
okay. Yeah. So they might need to talk to somebody about it then.
Yeah. They offer counseling for
Yeah.
that.
Yeah, there are a lot of medical places like this website that I went to for the cystic fibrosis. I'm sure that any place that does the cystic fibrosis treatments have anybody and anything on the staff that you might need to help you cope or to help your children cope. That goes with staff, distractions, whatever you need.
It just always amazed me. I would assume, and this is just me, that if you had a procedure done on your brain, that you might have nightmares afterwards. But the patients that I took care of and the ones that I would read about in my nursing magazines would always be the ones that had heart procedures done.
Well, your heart, maybe I'm being ridiculous, but your heart's a muscle, and muscles have memory. And I don't know, there's a connection there probably.
Yeah, and I think so too.
Yeah.
I do. And it
Well,
wasn't until just recently that I learned that muscle has memory. I mean, you talk about muscle memory, like when you go to catch a baseball or catch a kid from falling, or you slam your arm across the passenger seat when you have to stop the car real quick. Knocked the breath out of my husband doing that one time. And he said, "What did I do?" Anyway, but yeah, it was the heart thing that got me at the time. I was like, well, how come people don't do that with their brain? You just had a brain tumor removed. How come you're not having nightmares?
Mm-hmm.
I don't know. It
I
just,
don't
it
know.
was odd to me at the time.
Yeah.
Yeah. Yeah. Well, there is a connection between your heart and your brain. I mean, your heart does provide your brain with blood. So there's the connection there. I mean, a literal connection. So, I mean, blood vessels and veins and stuff, it's all connected. We're all one machine. So we're all connected. Every part of us is. So, how do you treat, prevent, or lessen the effects of procedural anxiety? Um, Discuss your previous experiences with the medical procedures that you've had with the medical staff. That way, they are going to be aware of any problems you might have because they can possibly help you or provide you with something that can help. Um, Identifying the aspects of the upcoming appointment or procedure that you can control. So, like Karen said about the dentist appointment, she became familiar with the procedure, familiar with the dentist. Be familiar with the things that are going on. And if you want to go online and research, that's fine. But you need to talk directly with your medical provider because what you're looking up online might be outdated.
Yeah. Or just false information altogether.
Yes. But so what you have in your head about what a machine is going to look like, it may not look like that anymore.
Yeah.
So you need to talk specifically to your medical providers. They can go over it with you, or they can tell you go to this website, read this website because this website is up to date. So talk to them.
Yeah. I just ended up going to a dentist that we go to church with.
Oh, oh, that's fine. I mean, you know them, right?
Yeah, we're friends actually.
Yeah. So there you go. That solves that problem. You can work with a child life specialist, a mental health expert, or anyone else who's in the team of the medical providers that can help you and or your child. Sometimes you might need to take medication.
Yeah.
I know we have a grandmother who had breast cancer, and anytime she went in for an MRI, she had to take a Valium.
Yep.
You know, and that if that's what you have to do, then that's what you have to do.
It was claustrophobic.
It is a type of claustrophobia. It's also the sound.
I did not know that.
The sound is also nerve wracking. It's a very loud sound. And
Mhm.
having been inside one of them, I can understand how an elderly person might have problems with all that sound.
Mm-hmm.
Yeah.
Yeah. So
Because there was absolutely nothing wrong with that woman's hearing.
no. No. So because I talked to Delilah about it, and she said it had a lot to do with the sound from my mom.
Yeah.
Oh, interesting.
Mm-hmm.
Hmm.
Okay, let me find. Let me go here. Okay, it talks about maybe writing down what you're feeling or what you're going through or what you're seeing and what you're smelling. It can help you identify what's causing it, and it can help you possibly deal with what's the overall effects of it. It can help you get through it. And if you have a child, pay attention to your child, pay attention to what smells are around, what machines are around, what sounds are around, and you can help identify what's causing it for your child.
Yeah. And children, instead of journaling, we've talked a lot about how journaling can help with any kind of type of anxiety or stress, but with children who may not be able to put words together like adults can, drawing.
I was going to say that. Yep, drawing. You can always have your child to draw. That's actually common treatment to help children who have been through traumatic events. So, and I made a little note here that says from me and our previous episode, use sound or music therapy to help you treat procedural anxiety.
Oh yeah, that's awesome.
Yes, and also when my husband had his four-wheeler accident, and Karen remembers what he looked like after.
Yeah.
Yeah, and he flipped a four-wheeler on his head, and he cracked his head, and he
was all
he
swollen.
looked awful.
Yeah.
Yeah, he couldn't open both of his eyes. All he could do was to see me or anybody else. He had to tilt his head back, have a little bit of slit in his eye. So while waiting for his procedure to happen, because they had to bring in all kinds of specialists and had to get clearance and all kinds of stuff going on with it. But one of the things they did for him was because he had the big gash down his nose, is they took him in to clean it up and suture it. when we went in, he told the medical staff he wanted me to stay. They kept trying to make me go away, and he said, no, she stays. And so I stayed. Now, the doctor was there when he said that, and the doctor told the nurse she stays. And I think the doctor may have thought he was going to be nervous about it or something. I don't know, but he's not nervous about stuff like that. My husband, he's not. I'm the one that's more likely going to be nervous because if I'm watching the sutures go in, it's like I can feel it myself
Yeah.
and I can't watch it. And that's the same even with television. If something's going on television and somebody's being injured, I can't watch it because it's almost like I can feel it myself.
Yeah.
So I don't watch it.
You have a lot of empathy.
Huh?
I said you have a lot of empathy.
Yeah.
I don't know. I don't know what it is. I have a hard time with it. So I think the doctor thought that my husband was going to have some issues. So he asked my husband, what kind of music do you like to listen to?
No,
And
that's cool.
the nurse had, I don't know if it was her phone or just something they had there to use, pulled up music that he enjoyed listening to. And the doctor played his kind of music while he cleaned his nose out and sutured him up.
That's cool.
That is cool.
Yeah. So they will help you if you it depends on your facility. Some facilities, especially for children, may have rooms painted different colors. If your child, oh, I love purple, they may put them in a purple room.
Yeah.
That may help your child. Or even
Yeah.
a grown-up, if you have a favorite color, they may put you in a certain color room.
There are reasons why
to them.
hospitals are painted the way that they're painted because
Yes.
research is continuously happening about what colors help people relax.
Yes.
Usually
Yeah.
it's greens and blues.
The girls' dentist office, every chair has a TV, and every kid gets to pick whatever they want to watch.
A distraction. Yeah.
Yep. Yep.
Yeah. And a lot of these facilities, especially if children are involved, they have TVs in them. They tell you pick what your child wants.
Mm-hmm. I remember going to the dentist as a preteen teenager and being able to bring in a Walkman to listen to music.
Okay. See, that's good. Yeah. That's real good. Although my body's not healthy, my teeth overall have been pretty healthy my whole life. So that's the one thing I've always said about myself is that, I mean, a lot of other stuff don't work, but my chompers work pretty. So
that's funny.
We had already talked about learning about the procedure, knowing everything you can about it, and discussing it with people that actually know, not just somebody who knows somebody who had it done. Talk to the actual providers. And you can talk to people who have had it done, provided they have had it done, not they know somebody who's had it done. There are ways to explain procedures for children to understand, so you need to talk to specialists about that if you don't know how to do it. There are things that the medical staff may want to know. They may ask you questions like how you're feeling emotionally before and during your procedure. Once you go back for aftercare, they may ask you how you're feeling now and how you felt the day after and things like that. Any surgeries that I've ever had done, the surgeons themselves call me the day after.
Mm-hmm.
Except for when I had the hysterectomy, she actually came into the hospital room, but she actually called me, I think, a few days after that. So, are you experiencing anything physically, like a racing heart, sweaty palms, anything like that? They may ask you these questions. They may ask you how long these experiences last. When did you first notice them? How long do they last? Did I answer that already? Yeah, how long do they last? They may ask you, they interfere like with your normal daily activities, like yesterday before you came in, did you do your day like you normally do? And they may ask you if you've done anything in the past that's helped you cope. So, and then you need to tell the medical care team that's working with you, tell them what's going on. Tell them that you start sweating. Tell them that you may be feeling dizzy, or you may be feeling faint, or you may be developing a stomach ache or a headache. Tell them everything. Tell them if you can or cannot sleep. Tell them everything. If you have a child, you need to let the staff know if your child is scared to come into the clinic. And you can ask, what can I do to help reduce that fear? One of the things it has here, it says, the last time a bandage was removed, my child screamed in pain. What can I do to help with that? Give me some procedure to help get the bandage off, which is going to hurt so bad. Tell me how to do it. Decrease pain. There are things that you can do to decrease pain. Numbing the skin with a topical and numbing agent for needle insertions, using a device to reduce the sensation of pain for needle injections, taking medications that are prescribed by your doctor. And I'll tell you, when I went in to have the carpal tunnel surgery done, where my veins are always hard to get, the nurse who was taking care of me to get my IV in and everything for the anesthesia, well, it was a man. Not that that matters, but it was a man. He gave me a shot to numb me before he even tried to hit my vein. I had never had that done before, ever. He was the first person who had ever done that. And he still couldn't get it. So he got an ultrasound machine, found the veins, and got my vein that way. That way he wasn't there digging and poking like they always do. That's how he treated him. So, decreasing pain, like for an infant, what they have recommended is breastfeeding, because that can provide comfort and a distraction, and it can decrease pain for an infant. And they gave another recommendation for an infant, and when I read it, I was like, I don't know if I'd want to do that because of the health of the teeth. They said to dip a pacifier in sugar water, which will work as a pain reliever.
The sugar releases endorphins, so
Yeah.
So I don't know. Maybe it would work, but I mean, that's up to you as a parent if you would want to do that or not.
If
I
they're
was
sleeping with a pacifier, hopefully they don't have teeth yet.
Well,
Sorry,
I would
that's
hope
my
not.
opinion.
But now there's also distractions. Both adults and children can distract themselves from medical procedures that cause anxiety by listening to music. We already briefly discussed that one. You can play video games. You can watch funny videos or cartoons or a movie or whatever you want to watch. I suppose this is something that's just coming out of my head right now, that if you like to write, you could have something to write, or a laptop to write with. You could do something like that.
I've seen videos on like Instagram and TikTok showing doctors doing magic tricks when they're getting ready to give kids their immunizations.
Right.
And they're doing magic tricks,
Distraction.
and then they just do that and bam, it's done.
Yeah. So yeah, it's a distraction.
So yeah.
Yeah. So there's all kinds of things that you could do as a parent, or the providers could do. I'm not sure magic tricks are going to work on an adult, but who knows? Maybe.
Maybe. Depends on the magic trick. For Dee Dee, somebody could make balloon animals, and that would probably do the trick.
There you go.
Let me show you how to make this platypus.
Yeah, let's make this.
That's what she'll be doing to help her anxiety.
Right.
Now, for children, they recommend to choose a distraction that's age appropriate. You could blow bubbles, you could sing favorite songs, you could play with toys, whatever is, because if you have a 2-year-old, the distraction is going to be different than a child that's, say, 8 years old. So you need to pick a distraction that's going to be appropriate for the age of the child. Comfort positions is recommended for an alternative to holding a child down, because that can be stressful and traumatic in and of itself.
Yeah.
Not only for the child, but for the parents. What's that?
I was just going to say, when we first started taking the girls to the dentist that they go to for cleanings, the kid would actually lay back in my lap.
Yes.
And the technician would clean their teeth while their head is in my lap.
Oh, wow.
Yes. And that's one of the recommendations here. It says to hold infants from birth to 12 months. Child sitting on a bed, or I guess in a chair, with the parent behind the child. They recommend for ages 1 through 5. The child sitting on a parent's lap facing out while the parent holds the child like they're hugging them, or the child sitting on the parent's lap facing the parent. These are options that can be done for children depending on their age. Now, speaking specifically of children, what a parent might see if your child has procedural anxiety, you might see crying, screaming, stopping talking completely, hitting, kicking, or biting a parent or a person trying to perform the procedure, running around the room, trying to leave the room, trying to hide behind furniture or anything like that. And it's important to know that this is not a behavioral problem. This is a response to fear.
This is
Right.
fear.
They're afraid. Yes.
Yeah.
So it's important to know that and don't punish them for it.
Yeah, no, I mean, my girls were complete opposites. I had one that had this as a toddler
Mhm.
and younger, and then I have another one that let anybody do anything to her. She didn't care.
Well,
She
there
had
you go.
nothing to be happy.
So there are things that you can do. I mean, even for you, if you find that, I don't know, maybe you're getting angry for no reason, and you're like, why am I doing this? Perhaps it's not a behavior for you. It's a response of fear. So you need to
Mhm.
consider these things.
Yeah.
So that's my research on procedural anxiety.
Awesome.
So
Do we have any final thoughts about procedural anxiety?
don't be ashamed of it if you have it. Get help. Nothing to be ashamed of.
Yeah, no, nothing to be ashamed of at all.
No, and it seems like, at least from my experience, that, well, with my experience with the oldest, you can work out of it.
I would guess that. I mean, I don't have any children and I don't personally have any experience with it, but I could see how that would be possible because if you learn to cope with the anxiety and the fears that you have, and then you're gonna come to understand that, maybe it's not so bad, or yeah, I have to have this procedure done, but this is, the only time I'm ever gonna have it done, so it's gonna be done and over with type of thing or whatever. You can learn to cope with it for sure.
Mhm.
Yeah, yeah, it was about 2 years of my oldest being real anxiety when when she went to the dentist.
Mhm.
But when she was about 4 or 5, she broke out of it and she started, I didn't have to give her any drugs. So like, okay, we're moving in the right direction.
That's a
Good.
good
Yeah.
thing. A lot of it
It is
is trust as well. Like if you're going to discuss this with somebody, make sure it's with somebody that you trust.
Oh yeah, for sure. Mhm.
What are we doing next
Uh,
time?
hold on. We found my phone. I think I got it on my phone. Spiritual gifts, quiz, and discuss. That's what I have
Yes.
wrote down.
Yeah, that's next week. We're going
Yes.
to do, I will send you guys a link to a spiritual gifts test that you can do
Okay.
online.
Mhm.
And then we will discuss our results in the episode. So
Okay.
I'm not going to send it until like that morning. And only take it
Okay.
once. Don't take it twice.
Okay. Can I ask you why you're only going to send it that morning?
So you only take it once.
Oh, okay.
No, I mean I can send it before then, but only take it
I
once.
mean, it doesn't matter, but if you tell me to take it once, I'll only take it once.
Okay. All right.
Or if I do take it twice, I'll only discuss the results of the first
First
Okay.
one.
I mean, so I will talk to you guys in the group and see you next week.
Okay, see you next week. Bye, everybody.
Bye.
Bye.
I think you started that. Thanks for joining us on Sister Sharpens Sister. We certainly appreciate you. And if you could, like, comment, subscribe, share, hit the notification bell. We'll talk to you next week. Bye.